Okay, it's Tierney here. I'm coming to you from Iqaluit, Nunavut, and today I'll be talking to you about Nunavut Suicide Prevention Strategy and our company and action plan. Next slide. To start off with a question for the audience, before the fireside chat session today, did you know that Nunavut has a suicide prevention strategy? Quite a few more no's than there are yeses. Okay, so we'll move on to the next slide. The action plan is a continuation of the work of the partners who created the Nunavut Suicide Prevention Strategy, and they're the Government of Nunavut, Nunavut Tunngavik Incorporated, the embracelife Council, and the RCMP. The partners took a public engagement approach to develop the strategy in the hope that it would ensure community support for its implementation. We also developed clear commitments, which will be outlined later, for each of the three core components of the strategy, which are prevention, intervention, and postvention. And we are in the planning process to develop strong evaluation tools and processes so that progress can be measured and reported back to Nunavut. Taken together, these commitments and evaluation measures will ensure the accountability of all parties in their promises to Nunavut. The partners committed to finalize an action plan to be released within 3 months of the release of the strategy, which was tabled in October 2010. However, the action plan was not released until September 2011 due to delays. The vision that we are working towards is a Nunavut in which the rate of suicide is the same as the rate for Canada as a whole or lower. Next slide. The action plan is a living document, and all stakeholders are encouraged to play a role in preventing suicide and building healthy communities in Nunavut. So that means that any organization or community, if they had an activity that they wanted to contribute to the action plan, or if they wanted to take on an item in the action plan, they are more than willing to do so, and we will continue to add items or adjust them as we move forward. Next slide. So some milestones of the strategy and the action plan. The working group began meeting weekly since 2008. In April 2009, a discussion paper was released, and following the release of the discussion paper, community consultations were held in all Nunavut communities, which took place from April until September 2009. And then following those community consultations, a summary report was released in April 2010. Next slide. In September of 2010, the strategy was finalized by the working group, and in October it was approved by all the partners and tabled in the Legislative Assembly. The Government of Nunavut working groups and community groups and partners met weekly on the action plan, and from October 2010 to August 2011, the action plan was drafted and finalized. In September of 2011, the action plan was formally approved by all of the partners. Next slide. So how will suicide prevention measures improve in Nunavut based on the implementation of the action plan? So what we're hoping to see is that Nunavut will have a wider range of mental health services and, mental health and addiction resources. They will have access to culturally appropriate grief counseling, enhanced mental health specialists in each region, stronger community-based counselors within the communities, increased cooperation between the Department of Health and Social Services, schools, and the RCMP, so that when children and youth are experiencing distress, they'll be in a better position to receive appropriate help, and that Nunavut will have access to clear information on risk factors relating to suicide. The partners do not anticipate that any amount of short-term action will produce an immediate decline in suicidal behavior in Nunavut. Many of the commitments within the strategy, even if implemented promptly and effectively, will not produce their desired effects for years or decades. It's a transformation of society that is necessary to achieve the vision of a low or average suicide rate. But we must celebrate positive actions and also ensure that outcomes are measured using objective data. Next slide. So how will things change in Nunavut based on the implementation of the action plan? We'll see early access to child and family programs and supports for children and adults. Children will receive social and emotional learning at school. Adults and youth who wish to will be able to take suicide alertness and intervention training in the language of their choice, as well as peer counseling. All communities will be better able to access funding agreements, which are designed to establish and support effective community-based wellness initiatives. and Nunavut will have expanded daily access to the Nunavut Katujjiqatigiit helpline, and the GN, Nunavut Tungavik Incorporated, the RCMP, and the embracelife Council will work more closely together to address key risk factors for suicidal behavior. Next slide. So as this slide indicates, the majority of suicides in Nunavut from 1999 to 2010 have been by males. What you don't see in the slide, but what I will tell you, is that the majority of those are by young Inuit males between the ages of 15 and 25. Next slide. As mentioned in the previous presentations, suicide is not just a concern in Nunavut, but our goal is to lower the rates of suicide to average or below average rates in Canada with our action plan. Next slide. So the basis for creating the Suicide Prevention Action Plan. The partners have specified their particular activity complete with a scope of work, timelines for completion, and resources pledged, and this will ensure accountability to every activity in the action plan. Also included were the contributions made through existing or new programs, resources, or funding support. Next slide. There are 8 commitments in the action plan, and I will go into more detail on each one in the following slides. Next slide. So the first commitment and its actions are specific to the Government of Nunavut and how it approaches suicide prevention. The focus is on leadership and interdepartmental and interagency cooperation. Next slide. The second commitment involves all partners and our collective effort to strengthen the continuum of mental health services provided in the territory. Next slide. This commitment not only focuses on government responsibilities, but also provides supports for initiatives at the community level, such as providing culturally and age-appropriate grief counseling and providing greater support to community-based counseling groups. Next slide. The partners will better equip youth with skills to cope with adverse life events and negative emotions is the third commitment. And it's looking at specific programming that targets at-risk youth through programming such as mental health first aid for youth. Next slide. Training in the areas of coping skills, anger management, healthy living, suicide prevention, etc. have been a focal point for us, as well as public campaigns targeting youth on issues identified as risk factor behaviors for suicide. Next slide. Commitment 4 involved adapting the ASSIST program to a Nunavut context, and a lot of time and resources were spent undertaking this initiative. The training is now offered to all Nunavut who would like to take it in English and Inuktitut, and moving forward it will involve ensuring the development and support of professional and community-based volunteer trainers. Next slide. Commitment 5 centers on research and data collection to allow us to better understand suicide in Nunavut and the effectiveness of suicide prevention initiatives. We are creating a research agenda and moving forward to close the gaps on particular issues such as the effects of teen cannabis use and child sexual abuse. Next slide. Commitment 6 relates to communication and how information will be disseminated to Nunavut. For example, with respect to developing specific communication tools for target audiences, the partners want to ensure that elders are able to receive information orally in Inuktitut or in Inuinnaqtun. Next slide. Commitment 7 relates to early childhood development and investments that the Government of Nunavut will make in these areas. Next slide. As you can see, part of this involves piloting a social and emotional learning curriculum in elementary schools in Nunavut. Next slide. Commitment 8 involves the partners providing support for communities to engage in community development activities, and part of that is identifying specific community-level stakeholder contacts who can assist with the implementation of the strategy. And we're actually doing this right now with our grief counseling proposal that's been put forward. So what is the current status of the implementation of the action plan? The implementation committee continues to meet on a monthly basis. The initial timelines that were laid out in the action plan have not all been met, but have been revised by the specific organizations in order to better meet target deadlines. Progress has been made on almost all of the actions and tasks, and we at the embracelife Council have dedicated ourselves to the implementation of the action plan. Next slide. So if you wanted some more information on any of the information that I just talked about, you can email me at thembracelife@inuusik.com, or you can visit our website, inuusik.com, where we have the strategy, the discussion document, as well as the action plan, all available on our website for download.
Thanks, Jenny.